facing me.
Yes. You're a movie star. This could be for your Emmy.
Did you start it?
Yes.
Okay, so we're gonna be doing skill number 25 on page 32, and this is a state testable skill, and we're gonna be ambulating or walking a person to the wheelchair. And so our supplies are gonna be our gait belt and our wheelchair. We don't need any gloves for this procedure. So we're going to start this procedure, and we will start it outside of the resident's room. I just want to bring the wheelchair over to you here so that you can see it. Most wheelchairs are set up the same way. And so when you go to your state test, your state tester will show you the different wheelchairs. But they fold up and down, pulling them this way. And you want to make sure that they are all the way open. They have brakes on both sides. You want to make sure that you always lock your wheelchair and your bed. And so this way it does not move. For our ambulation skill, we are going to position the resident, we'll put them over there 10 feet. So when you begin your skill, you're going to know where those 10 feet, where those 10 steps are. You're not going to have any footrest on them. And what I mean by a footrest is there'll be two of these that some residents use to rest their feet on. And it opens up with this little lever over here. And there's little circles over here that line up with the wheelchair. And so we'll press this little lever out and we'll come down here. Our wheelchair would be locked like such. And a resident can put both of their feet on here and we can push them out. But for our skill, we're not going to be using that. So I'm going to remove this footrest. We always want to make sure that our wheelchair is in a locked position. When we're getting a person out of bed, if you look on step number 1, you always have to have the resident's feet flat on the floor, and you want to make sure that they will have their shoes on. Some beds, depending upon the facility, they may go all the way down to the floor because those beds are for residents who may fall out of bed or they roll out of bed. We don't want our residents to roll out because we don't have side rails like we have here, and side rails are considered a restraint, so the bed goes all the way low. If your testing site has beds that go all the way low, you don't want to raise it to the lowest position because when you get a person out of bed, you want them to have their hips at a 90-degree angle. And I'm going to show you that. Sometimes the beds will go all the way down and then it's harder for them to get out. So you just want to make sure that the residents' feet are flat on the floor and they're at a 90-degree angle. Steps number 3 and 4, highlight them, star them. You need to lock the brakes of the bed before standing and also lock the brakes of your wheelchair. These steps, pre-steps for this skill, are going to be the same as your pre-steps for getting someone out of the wheelchair. And skill steps are not order dependent unless they say before or after. So if you could write these down, that would be perfect. First, you're going to explain the procedure right in, maybe at the top. You're going to explain the procedure. Your resident is going to be laying flat in the bed. This is not something that's in this packet here, but your RN tester would like us to elevate the head of the bed and then assist the resident to move to the side of the bed. And so I'm going to show you how to do that. But first you're going to explain the procedure to your resident, and then you are going to position and lock your wheelchair. Then you're gonna lock and make sure your bed is in the lowest position. You're gonna elevate the head of the bed. And then you're gonna assist the resident to the side of the bed. And this is when you're going to have them put on their shoes, and while they are assisting you in putting on your shoes, you can make sure that that bed is at a 90-degree angle. So in that particular order, that's how you're going to be getting your person out of bed. And then we have our gate belt, and you were all tested on this at the first RN testing site. But just as a review, you're going to place the gate belt through the teeth side first, and then you're going to place it through the other loop, and that's when you're going to tighten it. And you're going to check to see, and you're going to always lift your person in an upward motion, like such. When you stand them up, their belt might loosen up, so you check it for tightness. If it's too loose, you sit them back down, and you can adjust the bed. There are only 3 skills that are considered safety skills, and that if the RN tester tells you that you forgot a skill, they're not going to do it for any skills except for ambulation and wheelchair transfer and modified bed bath. So for the modified bed bath, if you put soap on your washcloth and you go to wash a person's eyes, they will stop you because they don't want you to put soap on a person's eyes if you forget to do that. If that would happen, you're going to fail that skill and the entire test. So that's a safety step. The other 2 times are going to be the wheelchair and the bed. So if they see that you didn't lock the wheelchair and you get all the way over to your wheelchair, they'll wait until you get all the way over to the wheelchair before you lower that person into the wheelchair. But if your brake is not locked, then they will stop you and they will say, you forgot to put those brakes on. Then you know that you did not do that critical step and you did not pass the skill or the state test. So the locking of the brakes are very important at the state test. And so a lot of people too, when they're doing I always have people do like a mock testing, and they get 5 skills, 3 or 4 skills actually, to prepare them when the time comes for their state test. Sometimes they mix up the ambulation to a wheelchair with transfer to a wheelchair. So please make note that in this skill, your resident is able to walk. In the transfer one, they are not. Okay. While you're walking your resident too, you're going to be walking them, and for the state test, it's 10 steps. And so you're going to count your steps out loud. The wheelchair is going to be placed over there, and you'll see that with this skill, but I just want to put it over here now for video purposes. So my wheelchair is locked. When I'm calculating my steps, I want to make sure that it's like 7, 8, 9, 10. I want to be facing the wheelchair as such. I want to make my 10 steps here. Turning around to the wheelchair does not count for those 10 steps. So you have to walk that person 10 steps to the wheelchair. You always want to ask that person if they can feel the wheelchair behind their knees. People, as a safety mechanism, it's just inside of us. If you ask your resident to sit down like this, they may be scared, like, where am I sitting? I'm free falling into a chair. So you're going to ask the person to reach back for the arms. And so, do you feel the wheelchair behind your knees? Can you reach back and touch the arms? And then on the count of 3, we're going to sit. 1, 2, 3. And so very important, you want to ensure at this point in time that your resident's back is next to the wheelchair. And so you're going to come around and you're going to look and you're going to see, is that person's back next to the wheelchair? And so with that, is there any questions before I start demonstrating this skill? Any questions at all?
So you need to make sure that it is actually 10 feet, so if you need to count out loud 10 feet, your nurse might put the wheelchair 5 feet away, you have to make sure that it is 10 feet away. Okay, that's your responsibility to make sure.
And so a little trick is, I'm over here, so so when I explain the procedure, I'll show you what I mean by that. So now I'm outside of the residence room, and I check my assignment sheet. I gather my supplies, I wash my hands with my hand sanitizer. Hi, my name is Deb, can I come in?
Yeah.
Hi, can you tell me what your name and date of birth is?
Shelly, February 3rd.
All right, Shelly. I'm going to get you out of bed today, and I'm going to put you in your wheelchair. We're going to take a walk to your wheelchair using this gait belt. Do you have any questions for me? All righty. So I'm just going to move your wheelchair. I'm going to pull your covers down here. Place this over here. I can check her bed. I'm going to make sure that her bed is locked. I'm going to provide privacy, even though she's going for a walk in your state test. That's a part of the skill, so we need to do that. Now I have here, so I'm going to do my little trick. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. When I'm placing my wheelchair, now I can come over, and you can't see it on the video, but I am moving my wheelchair 10 feet, and I am locking the brakes.
Video is just if people like me at the Capital class, like everyone is here can see this, so I'm not super worried that it's not in the frame.
Alrighty, and so now it's time for me to get you out of bed. So the way that the RN testers would like you to do this is you're going to just elevate the head of the bed so it's easier for the actor to get out of the bed. And it also saves your back a lot of undue stress at the end of the day. So now I'm going to assist her to get out of the bed, and she's able to walk, so she can help me some. So I'm going to put my hand behind your back here, if you can lean forward just a little bit. And now I'm going to place my 2 hands underneath your hip legs here by your hips. On the count of 3, we're going to move to the bed, okay? 1, 2, 3. And now if you can move a little bit closer towards me. So I have her positioned. So now I come over here and I can look and I can check the alignment. She's 90 degrees. Here we go. Can you put your, help me and put your shoes on for me? And so I'm going to ask you to put your arms above your head so I can put this gait belt on. And I can lower your arms. And remember, I'm putting it on a little bit off to the side. She's got a bulky sweatshirt on, so this is great. I can show you. I need to really pull that. Hold it so it doesn't slide away on me. And now I'm pulling it, I'm checking it for tightness here. I'm going to take my belt and just tuck it in a little so it's not in my way. So now I'm going to have you stand on the count of 3, and we're going to take 10 steps over to that wheelchair. Do you have any questions? Okay, so if you can spread your feet for me. If you want to put your arms on my shoulders, on the count of 3, we're going to stand. 1, 2, 3. I check my belt for tightness. Are you dizzy?
No.
So what I'm going to do is I'm going to put my hand with an underhanded motion behind her, and I'm going to direct her with my other hand. We're going to take 10 steps to the wheelchair, okay? Little small steps. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And now we had an extra couple. She's facing the wheelchair. Can you turn around for me? 1, all right. Is your knees behind touching the wheelchair?
Yeah.
Can you reach down and feel that? Arms, feel for the arms. Alrighty, on the count of 3, we're gonna get lowered. 1, 2, 3. Let me just check to make sure, yep, your hips are back there. So now, I'm gonna take you and I'm gonna roll you over. You can lift your feet up for me. I need to roll you back over here so that you can be near your call light. And I'm gonna take off your gate belt. And I leave her unlocked because if it were locked, that would be considered a restraint. There you go. If you have any other questions, Alrighty, have a good rest of your day. I'm gonna come over here and then I'm going to remove my privacy curtain and end of skill. Does anybody have any questions on that skill? Questions?
Should we lower the bed before we leave?
The bed was already lowered when we got her out. Part of, oh, the head of the bed, no, you don't have to do
Okay.
that. Great question though, and this was already lowered, yes.
If they're sitting on the edge of the bed before you're going to lift them up to get them to stand up and their feet aren't fully touching the ground, can you lower the bed while they're sitting in that upright position, or is that?
Yes.
Okay.
And you ask them to move forward a little bit so that you can get the height of that. And then for this skill, they are able to help you to put their shoes on. And for the others, but if not, then you would need to go down and put their shoes on, and then I would do the lowering. It doesn't matter because it's not specific as far as step dependent. You can do that either before or after the shoes and lowering the bed. Any other questions? Can I keep you here just for a minute? That's right, you're gonna be here for more than a minute.
Wait, can you do the?
So now,
What time does their hours start?
Uh,
Oh, you're here till like 11:20.
Yeah.
Okay.
perfect. So now, the next skill is going to be assisting a person, to walk with a cane. And that's on page 33. For this skill, we're gonna start the skill with our resident sitting in the wheelchair. You can lift your legs up for me. I'm not gonna do the entire skill for sake of time and demonstration purposes, so I'm gonna make sure that my resident is in a chair, and then ahead of time she would have her gait belt on. So I'm gonna show you how to put that on once again. Can you lift your arms for me? Lean forward a little bit. You can put them down. So this we're doing prior to the start. Just gonna have her sitting here. A little bit. So this is RN testing night. You're gonna put your gait belt on twice. You're gonna put it on for ambulation as well as transferring. So we don't need to see you putting it on for the cane and for the walker. And here is my cane. So I'm gonna come over here so that you can see me. When a resident has a cane, you wanna make sure that you check the tip of the cane. You wanna make sure that the rubber is there. If there's any metal showing and exposed from the cane, you wanna let your your RN know that. You don't wanna just wait until it gets down to the bare metal. You wanna let them know ahead of time so that they can order another cane. But if it is like metal and the rubber's not there, then they're gonna slide and it's not gonna give them that support. The physical therapy department will measure this. This should be at a person's hip. And they have little buttons here that you can see, and there's little holes. You can press this button in and you can move the cane to any different side that you want. You're gonna place the cane on the resident's strong side. And so then when the person is walking, they're gonna put the cane forward and they're gonna step into it with their weak side. and then they're gonna pull their leg through. Then they put the cane forward with their leg and walk this way. And that is how the resident is gonna be walking. When they turn, they can just use that. And that's how they're going to do that skill. You're gonna have them, can you put this into your right hand? And so now I can begin the skill. I started with this. So now we're going to stand you up with your cane. You already have your gait belt on. When you stand up, can you press off the wheelchair arm here? So if you want to put that there, her weak leg is her left leg. So I'm going to come in and I'm going to support that. On the count of 3, you're going to stand up, okay? Push with your arm and your this arm here on the cane. 1, 2, 3. Are you dizzy? Alrighty, so I'm gonna stand behind her just like I did with the ambulation skill. And can you move your cane and your left foot forward for me? And step through, excellent, and just take some steps. Doing a great job. You can turn. Wonderful, come back over. Left and right, yep. Left. And now, when she gets to the wheelchair, she can turn for me. And now can you feel back? On the count of 3, I'm gonna have you sit. 1, 2, 3. And so now I'm gonna come over and I'm gonna make sure that her back is in alignment. And then that's going to be the end of that skill. And I would unlock the brakes and move on and complete the rest of the skill. But this is how that's gonna end. Question?
Do we have to walk 10 steps for this one too? It doesn't say.
Do you want them to keep that in their minds or not?
I think that's a good idea, just so
Yeah.
that we get in the habit of 10, 10, 10.
Okay, perfect. Yes,
Mhm.
great question. You'll walk them 10 feet.
So walk them 10 feet, I think.
10 steps. And when you're doing the 10 steps, it's like this. Walk each step, left, right, 1, 2, 3, 4, 5. It's not like 1. It's every time you take a step, that's gonna be a step. Yes.
And you said that when we do the skill, the belt will already be on?
Not for when you're doing the cane and the walker. They'll be sitting in they'll be sitting in the wheelchair with their gait belt on. But for assisting them to ambulate to the wheelchair and for the walker, they won't be. You will be putting the gait belt on.
And then
Okay.
just make sure you know that you're putting it on the right side. So like last week when we were trying to like biomechanics and like having a good base, having the cane on the strong side makes it so that when they step with their weak side, they have a good base because they have support on both sides. Okay?
And so this is a 4-wheel walker, and as you can see, the cane has wheels on it. Sometimes the walkers do not have wheels on it; they just have tips. The same thing for the walker. You want to make sure that the rubber is not worn through, and they also have here where you can raise and lower the walker. And so the walker, you want to have it so that the resident's arms are bent like this. You don't want it too low, you don't want it too high, and physical therapy will have adjusted this, but just like the cane, you want to make sure that you double check it because sometimes people can come in and play with it. Sometimes residents may be starting dementia and they love to play with things, so make sure that it is the proper height for them. When they're walking, they're going to stand up, they're going to hold on to this, and they just come in and they walk like this. They don't walk like this. You want to have it close to your body when they're walking. Some are really fancy, and they have a chair, like a little seat here, and the seat opens up, and they can put their stuff in the seat, and they might also have brakes on the walker themselves. And so when they come with the walker and they go to sit on the bed, they'll put their brakes on and they'll hold and they'll lower themselves down, and they know that they have to use their brakes to raise and lower themselves. and some of them decorate them for the different holidays, as well. And you'll see that some have baskets, on the front where they put their stuff in, because it's, if they have difficulty walking and they're going someplace, they wanna make sure that they take everything, like their purse or whatever, but, so they'll put their stuff there. And so this skill is gonna start out, once again with them, already, in the wheelchair with their brakes on. And so I'm gonna start it from here. So we're gonna be using your walker today to get you up and to walk you 10 steps around. Is that okay with you?
Yep.
Have any questions for me? You comfy? You have your shoes on. And so now I'm making sure that my brakes are locked. And so I'm moving the wheelchair into my resident. Can you put your arms over here? So now I'm supporting the walker with my left foot, and then whatever side is her weak side, we'll just continue with the left. I'm gonna be putting my foot over here. On the count of 3, we're gonna stand up. 1, 2, 3. Are you dizzy? I'm checking the belt for tightness. Now I'm going to come back behind her. You can move the walker just a couple of inches forward and step into it. Excellent. And we're gonna do that 10 steps. And that's 7. We're gonna turn around now. And you can lead your resident like you're walking. When you get to your walker, just turn around for me before you get there. Just roll that around. Excellent, now you can come back. Do you feel the wheelchair behind your knees?
Yeah.
Alrighty, do you want to feel the wheelchair arms? On the count of 3, I'm gonna have you sit. 1, 2, 3. I'm gonna come in, I'm going to make sure that her back is against the wheelchair. And since this is the last of my ambulation skills that we're gonna test you on, I can remove her gait belt. I can make sure that the brakes are unlocked. I give her call light, and I remove her privacy curtain. And that's our ambulation skill. Thank you very much. You can look. And you're gonna get into the bed now, right,
Okay.
for me? So the next one, if you can take your shoes off and lie down again. Move this out of the way. It's going to be wheelchair transfer. And that is on page 34. And so for this one, as you see, steps number 5 and number 6 are bolded, but we're gonna use the same steps that I demonstrated a few minutes ago on getting the resident out of bed to the wheelchair. That's how we're gonna do that. And so we're gonna come in, we're gonna have our equipment, and then we're gonna explain what we're doing to our resident. And then I'm gonna make sure that the bed is locked. And I'm gonna elevate her head of the bed so that she can get up easier. Then I'm gonna help her to move to sit to the side of the bed. I'm gonna check to see if her hips are 90 degrees. And then I'm going to have her put her shoes on. It doesn't matter which order you do that in. Once she is sitting properly, then I'm gonna put my gait belt on. But now I've locked the bed and I checked the bed. I'm making sure that my bed is locked. Once I get my resident out of the bed and she's sitting there, then I know where she's sitting. I can move my wheelchair to the bed at that time. So I'm gonna roll this in and I'm going to say that she's sitting over here. I'm gonna bring my wheelchair in now. I'm gonna have it very close to my resident, just like this. So I'm gonna just sit right next to you for a second here. So this is how close I'm gonna have that wheelchair, because my person is not gonna be able to ambulate or to walk to that wheelchair. If I brought it in ahead of time and I placed it there, and I have the wheelchair over here, when I'm assisting her to get her out of bed, then I'm gonna have to lift her legs all the way over to the bed, and that's gonna really hurt your back. So we don't wanna do it at that time. We wanna make sure that we see where is my resident sitting, and I wanna make sure that I position it very close, because when they get out of the bed, the only thing that they're gonna be able to do is they're gonna stand, they're gonna pivot, take us and brace themselves and sit down. Your wheelchair would have been locked, but that is the only steps that they can do for a wheelchair transfer. Any questions on that before I start it? Okay. So I'm gonna come out, I'm going to make sure that I checked my assignment sheet. I am going to use my hand sanitizer, gather my supplies, which is my Cape belt and my wheelchair. Hi, it's Deb, can I come in? Hi, can you tell me your name and date of birth?
Shelley, February 2.
Awesome, Shelley. So today we're gonna get you out and we're gonna transfer you to the wheelchair. Do you have any questions? You comfy? So I'm gonna provide her with some privacy. Just gonna open it up. All right, Shelley. So your colleague isn't in the way, so I'm gonna just move this down. So I'm gonna raise your bed just a little bit so that your head is a little more elevated to make it easier to get you out of bed. Alrighty, I'm gonna make sure that your bed is locked. So I've raised her bed. I'm making sure that the bed is locked at this point. And so she's able to help me somewhat. So just like in our ambulation skill, I'm gonna put my hand behind your back, and then the other one is gonna go underneath your hips, and on the count of 3, we're gonna move you over to the side of the bed, okay? I'm gonna sit forward for me just a little bit. Alrighty, on the count of 3, we're gonna move, we're gonna bend our legs, 1, 2, 3, and then she can scoot a little bit towards me. Can you put your shoes on for me? And at this time, your RN tester will let you know if your resident can put them on or they can't. You may see videos where when they're getting people out of bed, they'll put their shoes on when the resident is in the bed. And just think about this. Residents' sheets are only changed twice a week or when a resident needs them. And so if you put the shoes on while they're in the bed because you don't want to lower down to get those shoes, what's on the bottom of your shoes? Right? So you don't want that in the bed. So if you see videos, don't do that. Just follow this video here. So now I'm going to come over and I'm going to check to make sure, and this bed is, it's a little high. It doesn't go all the way down, but her hips are in a 90-degree angle. My bed is locked. Now I can bring my chair over and I'm going to put it that close. I'm just going to lock your wheelchair here. I'm going to put this gate belt around you, so if you lift your arms for me. You can put them down. Start it on the side. I'm going to pull it and I'm going to hold it so that it doesn't slide on me the best that you can. Now put it through the other loop, and this is when I check it for tightness. Place my belt there just so that it's like this, so that it's not dangling and get caught in something. And so now can you move your legs apart from me a little bit? On the count of 3, I'm going to have you stand and pivot, you wanna make sure you say pivot to the wheelchair. Alrighty, so, if you're gonna place your arms on my shoulders, on the count of 3, we're gonna stand. 1, 2, 3. Are you dizzy? Alright, can you step and turn, step and pivot? Do you feel the wheelchair behind your legs? Take your arms and reach for the armrest. On the count of 3, sit, please. 1, 2, 3. I come back to see if she's fine. She is. So now I come over and I remove her gait belt. I am going to unlock her wheelchair. And I'm going to move her to her collie. Is there anything else I can do for you? Well, awesome. So then I come over and I remove her privacy curtain, report, record, document, and end of skill. Thank you so much on this one. If you just want to stay there for a minute. Elianne, can you scoochie through?
Absolutely.
And we'll show just the placement for the 2-person. We're gonna have our resident already. If you can sit back in the bed for me.
Just gonna scooch you through.
Have a seat. You can put your arms down. Once again, you can start with it to the side and pull it.
If anyone needs to stand up to see or anything, also welcome.
Alrighty, and so now, when you're testing out on this step, we're gonna have, this is all you're gonna do for the wheelchair transfer. If you can move your legs open for me a little bit. Elianne and I are gonna grasp the gait belt. My hand is gonna be behind here and in the front like this, and hers is gonna be the same on the other side. So we're gonna bend, and then on the count of 3, we're gonna raise you. 1, 2, 3. Are you dizzy? Alrighty, can you take a pivot for the wheelchair?
When we talk about
Excellent.
body mechanics, that's pivoting.
Alrighty, can you feel the wheelchair behind your legs? Alrighty, can you reach for the rests, armrest? On the count of 3, have a seat. 1, 2, 3. She can be doing the gait belt while I come over here and I'm checking to see if her belt, if her back is close to that. And then she can unlock the wheelchair and give our resident the call light. And then that's the end of our ambulation and our wheelchair skills. Any questions on that?
So, I know you've been asking if the resident is like dizzy or anything. If they say yes, do you want us to sit them back down in the bed or like stand
Yes.
for a minute? Okay.
They can stay seated. Because sometimes the person's blood pressure drops when they stand up, or when they sit, the blood pressure will go down. And so you want to make sure, but at your state test, nobody's going to say that. And when you're being actors and your residents, you're not going to say you're dizzy either. But great question.
When you check if their back's like all the way against the back,
Mhm.
what if it's not? Like, what would you do?
Great question. That came up in the first class too. So can you scoot a little bit forward for me over here? So if they
Let's have her
didn't,
turn around. That might be easier
okay,
to see.
turn sideways.
Yeah. So that they can see.
Yeah,
them.
face sideways a little bit. So
Okay,
she's
That's
not,
probably good.
so she's not, you wanna lock your side, Elian, and I'll lock mine. So I come over here and I look and it's not, so I can ask my resident if she can move by holding on to this, and we'll try it again. If not, we can come over here and grab the gait belt. Okay, we're gonna move you on the count of 3, push with your feet, 1, 2, 3. And we can just scoot her back, any which way that, we can get her back. Great questions. Any other questions?
You do need to make sure they have their call light at the end. That's when they can sometimes get missed because they're in a chair.
still make sure that they have their Colate.
And they're always gonna have the rights. Can you show people how you just scoot around like that? So this is how residents will roll around the facility. And so generally they don't have their footrest on, only if they're unable to, or if they have like 2 weak sides or a weak leg, then they'll have, sometimes they only have one footrest on, and then they propel themselves with the other. But those are our ambulation skills. And you have to leave at what time now?
What if they wanna like go somewhere?
Like if they wanna go somewhere that you need to take them, or they wanna go somewhere just like on their own to go visit their friend in
I
the
don't
next
think we'll
door.
have enough time
Like-
for.
I don't know, like what if they wanted to go to like a main area, like everyone else?
So they're more than welcome to scoochie themselves over there. Or if you have the bandwidth, the ability, if they need help to get them there, we would wanna get them there, but we wanna also promote independence. So if they're able to get themselves there, and then we can also like encourage and praise the fact that like, oh, like, hey, you made it over there in good time. Or I saw that you were kinda scooting around today. So we wanna make sure that we, even though it's faster for us to help, we wanna make sure that we're still promoting independence and encouraging residents to move on their own if they're able to.
Any questions? All right, so, any other questions before we end our, wheelchair skills? All right. So since you have to leave, can I have another, volunteer, please?
You will be on camera if you're okay with that.
Okay, can I have you? Excellent. So we're gonna, and you can bring your book and your pen. You wanna move that over there for me to get that, thanks. You can get in the bed without your shoes. And so this is a great skill to get. If you get range of motion on an arm or a leg, that's beautiful, because it's not, doesn't have a lot of steps, like bedpan has 38 steps. As you see, this one only has 10. And so for the range of motion on the shoulder, you're just gonna cross out step number 9. Range of motion is done on residents who can't move their body parts completely by themselves. And so passive means that you're gonna actually help them to do it. Active range of motion, they're gonna be able to move their arms, and so you're gonna be supervising them. But for these skills, it's passive, so they're not gonna be able to help. And so if the number 5, that's an important one, highlight that, star it. Student must ask at least once during the range of motion exercise if there was any discomfort or pain. I usually do that before I move each body part, and what I do is I say, I'm going to move your arm above your head 3 times towards your ear. If you feel any pain, let me know and I'm gonna stop. So I let them know ahead of time what's gonna happen, and if they feel any pain, I'm gonna stop. The next one, number 6. Just like with the gait belt, you wanna support the resident's arm and elbow and wrist. So you're gonna support all their joints, and you're gonna do it in an underhanded motion. So, it's hard to see with, no, that's totally fine, but where it bends at her elbow and here at the wrist, you're gonna hold it in an underhanded motion. You don't wanna hold it like this. Your both hands are gonna be underhand, and then you're gonna raise it, and you're gonna be holding on to it at the whole time. You don't wanna, sometimes, people do this and then their fingers go up. You don't wanna just support it with your your pointer finger and your thumb. So you wanna hold the entire hand so you get credit for that it's supported. So you wanna hold both of them at the same time. At your state test, the head of the bed is gonna be elevated, because part of that skill is that you're gonna have that person laying flat in the bed. Also, sometimes people practice the arm and the shoulder and the leg at the same time. They don't lower the bed and go through all of the post steps. And so when the time comes to do the state test, they do the arm and the leg. If that would happen, you're not gonna fail the skill, however, you've just added on another skill. And so that's going to take away time, it's gonna suck up those minutes, and you don't wanna do that. So please practice doing, the skills separately, of each other. And so for this one, you're only gonna expose the body part, that you're working on as well. So your resident is gonna be laying in the bed, with their sheet all the way up, to their neck. And so I'm just gonna move this. And we're gonna move this. Alrighty, for this skill, I don't need any steps, but I'm coming over, I'm checking my assignment sheet. I don't have any supplies, I use my hand sanitizer. Hi, it's Deb, can I come in?
Yes.
Hi, can you give me your name and date of birth, please?
Addie Dreamtug.
Awesome, you're a Gemini. So Addie, what I'm gonna be doing is I'm gonna be exercising your arm. Do you have any questions? All right, I'm just gonna make sure that your head of your bed is flat, so you're in a supine position. I don't need to say that at the test. I'm just saying that so you get familiar with the words. So now I'm gonna come over, I'll provide my residents some privacy. I'm gonna raise the bed to a comfortable working height. Abby, you're gonna go up. I'm gonna make sure that my bed is locked. Alrighty, so Abby, I'm just gonna expose this arm. I'm gonna move your call light. So I'm just exposing her arm like I did for the modified bed bath. So Abby, what I'm gonna be doing is I'm gonna be moving your arm up towards your ear 3 times. If at any time you feel any pain, let me know and I'll stop, okay? So I'm supporting her at her wrist and her elbow. So I'm gonna move you 3 times. Holding on, 1, 2, 3. How is that?
Good.
Awesome, so next I'm gonna be moving her arm out to the side. I'm gonna be moving your arm out to the side 3 times. If at any time you feel any pain, let me know and I'll stop. And I'm coming all the way out, 1. I'm doing it slowly. I'm not doing it fast. All right, are you comfortable? Do you need anything else from me? Great, well here is your call light. Your bed is locked. I'm going to come and I'm going to lower your bed. That is in the lowest position. I'm going to remove your privacy. Report, record, document, and end of skill. I've washed my hands with hand sanitizer as well. And so now if you can turn to the next page. I can use your leg again.
Yeah.
Thank you. And so this is pretty much identical, but what we're gonna be doing is we're going to be exercising her knee and her ankle. So we're gonna be doing the steps the same for this, and we're going to be supporting her joints at all times. And so I'm just gonna set my paper over here, and I'm going to check my assignment sheet. I don't need any supplies. I'm using my hand sanitizer. Hi, it's Deb. Can I come in?
Yes.
Hi, can you give me your name and date of birth, please?
Addie Dreamtug.
Addie. Excellent. Addie, what I'm going to be doing is I'm going to be exercising your knee and your ankle. Do you have any questions? Alrighty, I'm just going to move your call light and make sure your bed is locked. Can give us some privacy. Notice I did that before I raised the bed. It doesn't matter if I do it before or after, as long as I get my steps in. Addie, I'm going to be raising the bed to a comfortable working height for myself, okay? So I'm just going to expose your leg and your ankle. All right, Addie, what I'm going to do is I'm going to be moving your leg towards your head 3 times. If at any time you feel any pain, let me know and I'll stop, okay? So now, once again, with an underhanded motion, I'm gonna get it at her ankle, and if you could bend your knee for me a little bit. And then I'm gonna get it at the end underneath her knee. Alrighty. On the count of 3, I'm gonna move your head. If you feel any pain, move it towards your head. If you feel any pain, let me know and I'll stop. Okay? 1, 2, 3. How was that? Awesome. Alrighty. Next, I'm gonna be exercising your ankles and your toes. And so I'm gonna come and I'm gonna support your ankle, and I'm gonna support the ball of your foot. I don't wanna put it all the way up like this. I just wanna lift it somewhat off the bed. Alrighty, I'm gonna point your toes towards your head 3 times. If you feel any pain, let me know and I'll stop. 1, 2, 3. How was that? Great. All right, Abby. So is there anything else I can do for you? Are you comfortable?
Yes.
Making sure her bed is locked. I'm gonna lower her bed. And now I remove my privacy, record documents, and end of skill. And so both of those are state testable skills. Any questions on that? Yes.
What would you be recording like?
And so if there was any type of issues, like with the cane, you know, the cane, you would report that. If you're doing a bed bath, if there's any type, you would report any type of skin irritation. And then every time you take care of a resident, you're gonna be providing documentation. Because if you don't document something, then that means it wasn't done. And so if they're coming in and they're doing an audit of the chart and it doesn't show, you have to, that you've documented something. And so sometimes you have to document, if a person is on intake and output, how much fluid did they drink? How much did they eat? How much did they urinate? So all of those things, and when nursing assistants document, the majority of the time, you can get up, you can sit up for me. The majority of the time, it's in a checklist type of a form. So you'll have your resident and you'll have your name and you'll have your set tasks. And so it'll be, you'll know each time they go to the bowel, if they have a bowel movement, you'll document it. And usually, if you don't have anything to write something down, document it at the time. Don't wait until the end of the shift. And so, let's say a person, you don't document that they had a bowel movement. You just, let it go, or someone else has your resident, and the nurse comes and they look and they go, oh, well, she hasn't had a bowel movement and such. So they may give her a laxative or something if she doesn't need it. So you always have to document everything in case it goes to a court of law as well. If you don't document that you did it, it was never done. Even if the resident says, yes, Deb did it, it doesn't matter.
So it wouldn't be specialized for an individual task?
It is.
So.
Yes, your checklist is like a part of your care plan, and then your tasks that you have in the computer are specialized towards you. So some residents, depending upon the computer program that you have, point click care, will list all of the skills, but then you pick yours individually. It all depends, but there'll be a list of things that you, as a resident, as a nursing assistant, will know, and that's going to be something, we don't train you on documentation here, only that if it's not done, if it's not documented, it's not done. But when you go to your facility, they will orient you to their computer system, and so you will know exactly how that works, when to document it, and when. I've seen people waiting until the end of the shift, and they're just like this. Well, you can't document a lot of different things, I know, because you can't remember all that stuff, so you need to write it down. Did that answer your question?
Yeah, kind of.
And then also just like specifically like with range of motion, like if they experience like discomfort, you would report that.
Right.
If they said something hurt, if you know that normally they can go this far and they can't, those are also things like you would report, or you saw bruises on them that you didn't see before. Those are a lot of things for this like specific skill that you might do.
And even if you, are doing, this skill, like, and you're not bathing them, and you notice they have short sleeves, and you see, well, they have a bruise, or they're red over here, then you report that too.
So you would report like any pain or discomfort, but is there anything else you would do?
As far as documentation purposes,
Like, would you just stop doing it? Like,
absolutely. So if she said that she had any pain, then I would just immediately, I would not do anything. Then I would stop that. So if she had pain moving her shoulder and our arm up above her head, I'm not gonna move it out to the side. I'm just gonna stop that because you don't know, all what to do. So I would stop documenting on that body part. But if you had to do the legs, sometimes in real life, when people are bedridden, you have to do their arm. And then you may have to do their wrist, even their fingers. You may have to exercise and extend their fingers. You can do the neck. Every single body part you can put through range of motion. And so if they felt any pain with the arm, stop that body part and move to another body part. But make sure you say, oh, okay, well, when I was doing the shoulder and the arm, that's when I felt the pain.
So if it was like they felt pain in their shoulder, could you still exercise the wrist, or?
I
you
would
just
not
wanna-
because it's connected
Okay.
and I don't know what's going on because sometimes, if a person has an issue with the wrist, the pain can actually, radiate to the upper part of the arm. And so I don't wanna hold it.
Would it be the same with the leg too? Like
Yeah.
if they had any pain up here, you wouldn't wanna do their ankle?
Nope,
Okay.
just completely stop. Great questions. Any other questions? I have one more skill and Eliane is gonna, help me with that one, but thank you so much. We're gonna show you how to, lift a person, up in bed using, a lift sheet. No, that's okay. Is there someone who wants to be lifted up in bed? Okay.
Are you doing skill 30 or 31?
I think it's 31, it says lift sheet, it's 31, and then,
Page 38.
and then we still have, positioning on side too.
Oh, okay.
Do you wanna
Well,
do
let's
it?
do you positioning.
Okay.
So if you wanna,
So we're just going through, yep.
you can bring your book so you can write excellent.
This is a great skill to practice at home, also to do on yourself. There are nights where I'm like, I can't sleep good, and I will like use pillows and prop myself up like this. It works very well.
Right. Yes. So, this skill does not have any bolded steps. However, in our call, not last call, but the call before, with Headmaster and the other, instructors and testers, what people fail to do, are steps number 5, 6, and 7. And then if you don't do those skills, if you don't move a person to the side of the bed, that combination there is enough to fail you, for that skill. Even if you don't do everything else right, in this skill, the tester will know if you didn't move that person to the side of the bed, that's an automatic even though, it's just a 12, but you have to move that person. And what working side of the bed means is the side that the person that's doing this, skill is gonna be on. So I'm gonna be moving my person, towards me, and so that's considered, the working side of the bed. Just like in, the perineal care, you have to position your resident on the side. So for that skill, when I have her turning to her side, I'm gonna ask her to raise her arm above her head, cross her arm and her leg, and I'm gonna reposition her that way. Also, numbers 9 is you're gonna put a device behind the resident's back. So you're gonna put a pillow behind the back. You're gonna adjust the pillow on the head, so that's your third pillow. You're going to have your fourth pillow underneath the arm and the shoulder, and then another one underneath their knee and their ankle. And so they're gonna tell you, what side, they want you to position your resident on. And one thing that sometimes people don't do correctly is if I'm going to be positioning my resident on her left side, and I have my supplies, I've gathered my supplies, and I come in the room and I go, okay, the resident's left side, and I go over here and I put the pillows on this side, because nursing assistant people, get that mixed up. It's not your side, it's the resident's left side. And so I've seen people at the test go, So I come in and I take the time and I go, it's on her left side. So that's the side that I'm gonna put my pillows to. Also on, step 2, it says ask a colleague to stand on the other side. At your state test, your state tester, is going to move to that side. So you have them there. So I just need a person to just stand there for me. Does anybody wanna just stand for me? Alrighty, you wanna come and you can stand. So you're gonna lay down and you're gonna be, in the bed. We'll keep you flat because you guys know how to raise the bed.
This is one where it will
We're not
start
gonna
with the
be-
head of the bed up, right? To trick them, do they start with the head of the bed up?
Sometimes.
So you have to just make sure that you will lower it if they do start with it up.
Alrighty, so let's leave the room. And I'm going to, I've used my hand sanitizer, I checked my assignment sheet, and my RN tester told me that I need to place, my resident on the left side. And so I'm gonna knock and we're gonna identify ourselves. Hi, I'm Deb, and this is, can you tell us your name and date of birth?
Grace, November 18th.
Hi Grace, today we're gonna place you on, your left side. Do you have any questions?
No.
Awesome. And so generally you're going to be turning a resident every 2 hours, and we're gonna talk about this when we do skincare, because we don't wanna get any pressure sores on the body. So we reposition a person every 2 hours. So you'll be documenting at 10 o'clock, you place them on their left side. At 12 o'clock, you place them what side, the right side, and you'll document the different sides. And so now my RN tester told me that I have to place her on her left side. So I come in and I go, okay, this is her left side, not my left side when I was standing out there. And so I'm going to move my pillows immediately over to this side. And these do not have a cover on them, and they don't fold very easily, so they're very, oops, see that? They're very slippery. And so I roll them over to my resident side. I can't ask my tester to do anything for me. So I'm gonna provide privacy. The only thing that my RN tester is gonna do,
This one's done.
thank you, that's a nicer one, yeah.
And then when all of you are using these, I would like you to have a pillowcase on them. You have them at your stations. We just haven't been using the pillows yet, so I haven't put the pillowcases on them. When you start to practice, please put the pillowcases on them. The zippered part is a bed bug cover, so just for safety, hygiene, we always wanna make sure that that stays on.
Perfect, okay. So now what I'm gonna do is I'm gonna just raise your bed to a comfortable working height for us, okay? Is that a good height for you? Okay, so we're gonna lower your covers to the bottom of the bed. Alrighty, so now what I'm gonna do is I'm gonna move her in 3 pieces, because I wanna move her closer to me. If I turned her over to her side now, she would be really too close, to that side over there. So I'm gonna move her in 3 parts, and she's just gonna move the top of her body, and then the middle of her body, and then her legs. And this is what everyone forgets. So what I'm gonna be doing is I'm gonna be putting my arm underneath your back and one over here above your waist, and on the count of 3 I'm gonna move you towards me, okay? Trying to bend my knees the best that I can. On the count of 3 we're gonna turn, move 1, 2, 3, just your, that part. And now the middle, I'm just gonna move the middle, and now I'm gonna move your legs, and I'm gonna move them closer. And so now, if you could raise this arm over here towards your privacy curtain, you're gonna cross this arm. And now, I'm gonna cross your leg over here on the count of 3, and I have to do everything, cause this is part of the state test. On the count of 3, I'm gonna turn you over towards the privacy curtain. 1, 2, 3, and she's there. Alrighty, so now she's not gonna go anywhere because my RN tester is there. I'm gonna take my pillow, and what I'm gonna try to do is I'm gonna try to fold my pillow in half like this, so that the edges go down. So I'm gonna try to release that, and I wanna put it so it's behind her back here. Alrighty, I'm gonna place this pillow underneath her back. Can you come over towards me just a little bit? Perfect. And so now, thank you very much. You can step aside for me. Thank you. And so now her arm is still above her head, and I come over here and I noticeably move that pillow so the tester sees me do that. And I adjust that. I'm gonna move your arm, I'm gonna place your arm, and I'm gonna have the pillow so that it's supporting her arm and her elbow. And last pillow is coming underneath her leg, so I take the pillow with my arm, and my other arm I'm supporting her leg, and then I place it under her knee and her ankle. I'm gonna come over this way, and I'm gonna make sure that her body is in proper alignment, and it is. Depending on your tester, you may pull those covers up. Is there anything else I can do for you?
Can you turn my TV on?
Sure, let me get you your channel changes so that you can see that. Don't say that during the skills testing because it's gonna screw your person up. So just come over, her bed is in the flat position. You don't wanna throw your person off with questions because you have it memorized, in your head a certain way. And now you're going to lower the bed. Alrighty, come over here and you make sure that you remove your privacy, and then you report, record, document, and end of skill. And so that one is also a state testable skill. Thank you so much for being my volunteer. And we had, you can get up now. Thanks. Is that comfortable for you? Was it?
Yeah.
Good.
Anyone willing to be a patient for us to do
I just have a question.
the lift sheet in
Uh-huh.
bed?
So, like, when you fold over the
Perfect.
pillow, is that allowed to touch your uniform?
Yeah, that's fine. You can come over here like this. You can, whatever way you can to bend that pillow. Like some of these, especially when they don't have the pillowcases on there, it's hard, but if that's the case, you just gotta kind of tuck it in. This way, it's gonna be like the reason of the pillow behind the back is because you just want to keep them. You don't want to have them totally on their back like this. So if you don't put a pillow in, then they're going to roll that way. So they just roll so that the pressure is offsetting from the back. Make sense?
Yeah.
Did you have a question or you were volunteering? Wonderful. Can you come in the bed for me? Thanks.
And I am.
And Eliane is my
Sorry.
assistant.
Yes. So a couple things about this skill, because this is one that,
Eliane loves this.
last week we talked about body mechanics, and we want to make sure that we have good body mechanics. And so oftentimes when we are at the bedside of our resident, our feet are like this on the side of the bed. However, if I'm doing this, is this good body mechanics? Absolutely not. So Your feet need to be turned towards the head of the bed. Instead of like this, your feet need to be like this towards so that you can move up with your patient, okay? Last year I failed a lot of kids because their feet were just like this, and that is horrible for your back. How many backs do we have? Yeah, we have one. So I want to make sure that we are protecting it. And even though it seems like a small thing, not a big deal, those small things, they do add up to big things. And so we want to make sure that we're practicing body mechanics that are good and proper at all times.
Exactly. And so, could you scoot down to the bottom of the bed for me?
So your feet are like touching the end of the bed.
So when you're the resident, you're gonna be at the bottom of the bed, and when people are laying in the bed and their head of the bed is elevated, sometimes they'll slip down to the bottom of the bed. And we used to make rounds with people when I was working on the floor, and we would go over, okay, well, it's time, let's go, we need to move up our patients. A little trick is when you're in the real world, you can elevate their feet just a little bit, so this way it doesn't have them slide to the total bottom of the bed. When we raise our resident, we're gonna do it with what's called a lift sheet, because we're going to be lifting our patient up in bed. And I'm not gonna open it the entire way, but you all are gonna have these smaller sheets on your bedside.
So this is not just a top sheet on top of the bed. This is, the white one is only for lifting the patient up.
And so right now it's folded in half, and it is a very, it's a long one, because when you're done doing the skill and it's not in your Minnesota packet, you will be tucking it underneath the bed. We keep this on the bed at all times after we lift our residents. We keep it there because we don't want to have to go through rolling them, turning them, putting them on this. They slide and they slide down with their sheets, and so then we use this to pull them up. As you saw with the perineal care, sometimes they'll have the linen protector. So if they have a cloth linen protector, that's going to go on top of this. And so all of that slides down into the bed. Some places have large linen protectors and they don't have one of these. If it's not dirty with feces or urine, you can use that to pull a person up in bed as well. But we're going to be using this lift sheet. You as a resident are going to be at the bottom of the bed with your pillow like such. And then for this one, you're going to get graded on how you talk with your partner. So Elian and I are going to leave, and we're going to check our assignment sheet. We do our hand sanitizer. We have our lift sheet. We don't need any gloves for this. All right, we're gonna knock and come. Hi, it's Deb and Elian. Can we come in? Well, I see that you've gone scooted down the bottom of the bed a little bit. We're gonna raise you up in bed. Is that okay? All right, so I'm just gonna put my lift sheet over here. So now I'm gonna lift your head up. We're gonna lift that up. And now we're gonna place our pillow at the headboard. And we don't wanna try to lift her with the pillow there because the pillow is gonna be in the way. So we're gonna put the pillow up at the headboard in case we get really strong. If we come up, we don't wanna knock her head to the bedboard. So we're gonna place that over here. And now we're gonna show you, you're gonna pull this all the way down to the bottom of the bed. I'm gonna move your collet out of our way. And so I'm going to open this up to see how it's folded. I don't want it to touch the ground. I can come over here.
I never want to see it completely unfolded, ever. Okay, like it should just be small. Okay, so when we put it underneath paw, we're just gonna roll him to the side so that it's in the proper placement underneath the core of his body as we move up, instead of the entire lift sheet covering
Yeah,
the
cause
whole
then
bed.
it's not, it doesn't support as well. And the bottom, the open parts are gonna go towards the feet, and the folded side is gonna go up towards the head. And so now I'm gonna be placing it on my resident as such. So I'm going to come over just like when we're placing, the linen protector on. I'm going to fan fold this like this. And now,
Love the bells.
because we're not gonna be rolling and positioning ourselves, we don't need to do the ballerina pose, as I call it. We're just gonna turn our resident from side to side. So what we're gonna do on the count of 3, I'm gonna turn you over towards Elianne. 1, 2, 3. I'm gonna turn 1, 2, 3. And so now I'm gonna place this underneath her, the best that I can. Alrighty, and I'm just gonna pull this up. Oh, you can come back towards me, and now Elianne will give her instructions.
Alright, I'm just gonna, if it's more comfortable, we can have your arm there, or we can have it up. You can put this arm over your chest, and then I'm gonna hold on to your shoulder and your hip, and I'm just gonna roll you on 3. Alright, 1, 2, 3. And then I'm just gonna pull this from underneath him
And
to
I'm
make
holding.
sure that there aren't any wrinkles. This is long enough where it could fall to the floor. I wanna make sure that I don't do that, because I don't want any germs in his bed. So, we're gonna make sure that it is rolled up, and I'm gonna roll it up as tight as I possibly can against him. So I'm just gonna have you cross your arms over your chest.
And we're also gonna have our resident put their feet up. Can you put your feet up on the bed for me?
You're gonna
You're gonna
you're
bend your
gonna bend
knees,
both.
and there you go.
Perfect.
So your resident for this skill is going to be able to assist, and so they can push off with their feet. Sometimes, in a facility, your residents may be on the larger side, and they're unable to do that. And if that would be the case, then you would get the controls and you would raise the legs so that their legs are up, so that you can pull them down if their feet were up, and go down so that you don't hurt your back and your legs. But for this one, she's able to do that. Elianne, feet placement, because I know you love
Yeah.
this one.
So here at the side, I'm gonna turn my toes so I'm facing there. So that's a really easy to the front. Okay? So we have it rolled up. This gives us a really nice thing to grip on. Okay, and then like Deb said, like you have to communicate with your partner. So someone's gonna count on 3.
Okay, on the count of 3, we're gonna move you to the head of the bed. 1, 2, 3. And so see how easy that was? And then we're gonna come over here, and we can tuck this in, making sure we don't have any wrinkles. And you can uncross your arms for me. Now you can lift your head, put your pillow. Are you comfortable? Anything else you need? Alrighty, I'm gonna lower her bed some, make sure that it's locked. I'm gonna come down here, and I'm gonna lower the bed. Elianne, could you remove privacy? And then and I would say report, record, document, anything that we had talked about previously. I use our hand sanitizer, and then end of skill. And then we just leave that in there, and it's there.
And then if at the end, if I remember, like it was my job to raise the bed, if I forgot that, I would just say, I would make a correction, and we would have raised the bed to a working height that worked for the 2 of us, when the skill is done. Another thing, as you're doing the skills, if you feel like the person testing you, whether it's at the state test, in the classroom, isn't seeing what you're doing, you can ask, hey, you could do something like, oh, did you see that I did that? And that's okay to ask, to make sure if you feel like someone isn't seeing all of the steps that you're doing. Did you see the way that I had my feet?
And this is
To
a
make sure.
state testable one, so we're good on
Yeah.
that.
So,
Or at the skill, RN testing.
hot diggity. Any questions?
All right,
And then the easy stand.
yes.
I'm gonna end this.
What time do you have to leave?
It's a long video.